Hey everyone. So today is day 2 from my surgery. I still sound horrible. Um, yesterday, I could not stop throwing up. So I had called my nurse's line and tried to figure out what I needed to do because I would barely eat and take my nausea medicine and everything else, like I said by a previous video, and it was not cutting it. Like, I was so nauseous, I was still throwing up my medicine as soon as I would take it. So, and I didn't know how much of the medicine got into my system in order for me to take another dose. So they wanted me to go ahead and go in, even though I tried to hold out as long as I can because they wanted me to drive back an hour away where I got the surgery done and go to that hospital so my surgeon and my doctor to be able to see me and they could get in contact with them. Um, I was in so much pain, crying pain. Like, I seen a lot of videos on here about this surgery and everybody seems to be like okay and make it seem like everything was peachy and things like that. But I'm gonna keep it real. It's definitely like that for me. And like I said before, I have a high pain tolerance. So for me to feel like this is really weird to me. The pain meds that they gave me last night in the ER, I think I stayed in there till I went in around like 12 or so, and I didn't get out until like 5 in the morning, 5:30 or so in the morning. I do apologize for my bandage. I'm going to show you guys how I changed my bandage on camera so that way you can see what I have to go through. But it's just going to be constant bleeding. So if you don't like the blood or like this video, you don't have to watch it. That's perfectly fine. Um, I didn't get out till 5 in the morning, but while I was in there, they gave me morphine again, and they also gave me some Dilaudid. But it seemed like it was not cutting it. I was still went in like a 10. I was off the charts for real. Like 10 is not even the number for real. 20 would be the number. And they just, you get into the ER and they ask you all these questions, and you're like, I don't want to answer none of these damn questions. Can you get somebody in here to help me, please? Because I was in so much pain. So, yeah, that they gave me that, and then I had to ask for more medicine because that wasn't cutting it. And they gave me more medicine, but that still wasn't cutting it. So, then they wanted to make sure I was able to keep food down. So they gave me saltine crackers and make sure I could keep that down. Because when I was throwing up, it looked like it was black. And what they told me is because the blood, during the surgery, I had a lot of blood go down into my stomach or possibly after or whatever. So, um, they told me not to worry about that. And sorry about my lips. I've been keeping up with the chapstick, but they're still dry. And I have to breathe through my mouth, so my mouth is still dry. And I've just been drinking a lot of water, the fun stuff. This morning I woke up to take my dose of medicine for my pain, and they did give me some different nausea medicine last night for the nausea because my Zofran was not cutting it at all. Um, it didn't do anything for me, to be honest with you. Um, then, so yesterday they gave me some promethazine, which is in a pill form. So I'm taking that and my pain medicine, and as you can see, I'm still in a lot of pain. I did just call my doctor earlier this morning to see if I could return those pain meds and get something different because it's just not cutting it. So they did just call me back maybe like 10 or 15 minutes ago and told me to alternate the pain with the ibuprofen. And I just hope that helps. Um, I don't know what everybody else went through. Maybe they didn't have the same surgery I did when I was watching the videos, but I really feel like they tricked me because they made it seem like such a piece of cake, and it's definitely not for me at all. Um, so right now I'm just going to show you guys how I changed my bandage and all that fun stuff. Let's see if I can find a wipe. And I'm sorry about the way I look. I honestly don't care about how I look right now at this point because I'm in so much pain. It's just ridiculous. So this is, I normally take at least 2 of these 4x4, I believe it is, gauze. And I fold it 3 times. So that way, and then that way. Then I take the folded part and put it against my nose, and I'll show you how that goes. And I'm sorry if you see blood or whatever. That's just going to happen naturally because they were in there hacking away. So I'm going to remove this. And I just been keeping up with the blood that I've been losing. So just in case I need to call and ask to see if I'm losing more blood than I'm supposed to. I normally just wipe around here. So I look like a little piggy because my nose is swollen, and I believe that gauze and the tape hold it up like that. I just look like a damn pig. So I try not to dig in my nose or anything like that because it will be painful. And I don't have time for that. I'm in enough pain. So I do that. And I take the gauze like this and put it right here. And just do it like that. Nothing fancy, to be honest with you. So, why do we do this? Because it looks like it's coming apart, yeah. And I'm already bleeding. So, I am absolutely exhausted from being in the emergency room so long last night. And I thought they were going to admit me, but I'm glad they didn't. But at this point, I wish they would have so they can monitor my pain and keep up with it, because even though I'm on a schedule to take my medicine and keep up with it on time before my pain comes through all the way, it's not cutting it at all. Today I'm going to start my antibiotics, and they gave me methylprednisolone and amoxicillin. They gave me some ointment that's supposed to apply to my cauterized area in my nose, but they have not removed that yet, so I'm not able to take it. I have my inhaler, which I had to take with me to surgery just in case I had an asthma attack. Ondansetron, which was the Zofran, that's for my nausea, that didn't do anything for me. I have hydrocodone with Tylenol in it. So I started all my antibiotics today, and I'm just glad that I did start it today because yesterday I couldn't keep my pain medicine down, even with the nausea medicine that they gave me. And hopefully this promethazine will start helping me with that so I can eat today, because I'm starving, to be honest. I'm just freaking starving. So, that's about it that I have for today. I'll probably get back to you guys tomorrow. Saying a lot of ums, and I'm trying not to breathe out of my nose. I'm still breathing through my mouth. I kept waking up last night because my mouth was just so dry from breathing through my mouth, and my lips were dry, and now they're peeling. But I've been keeping up with my Carmex and the water. I can't think of anything else that I might have left out of this video because I'm trying to be very detailed so that way you get the real gist of what's going on here, or if you plan on having this surgery or want to have this surgery. It's definitely not to scare you away, but I'd rather know the truth than to expect everything to be peachy and get there to be like, this shit is not what I thought it was. So, yeah, I'm just going to try to see if I can find something to eat and try to lay down because my baby's laying down right now, and I need to get all the rest I can while he's asleep. Thank you guys for watching, and you guys have a great day.